Hi there, it's Anitra. I'm doing my 6th video on this cancer journey that I'm on. I was diagnosed with triple positive breast cancer in October last year in 2017, and I started doing IPT, Herceptin, to treat myself. I did 6 treatments of that over the course of 7 weeks or so, and the tumor changed, but didn't change enough. It didn't shrink enough, basically. So I just recently decided to go back to the hospital and the oncologist that I've been seeing and do the full dose of Herceptin. So I went from doing 50 milligrams every week to doing now 500 milligrams the first time, and the next time will be around 420 milligrams. So I'll go in for that 2 Wednesdays from now. Today's Saturday. Just this last week I had acupuncture, and that was really great. It's not something I'd normally do for myself. Having cancer or pre-cancer, post my former life before having cancer, it's not something I really treated myself to, so it was great. She did some craniosacral and put needles in me, and she said that the person that I went to for acupuncture said that adrenal fatigue and really shot adrenals are very common in people that get a cancer diagnosis. So she could see it by checking my pulse and looking at my tongue. So we're going to be working on that. I've also stopped drinking coffee. It's not something I really drank a lot, but I would drink it once or twice a week at times, and I'm just going back to tea exclusively so I can make sure I'm not taxing my adrenals any more than I might otherwise. The other thing that's up for me right now is I'm really strongly considering not just the lumpectomy, but having a mastectomy, and with that it would just be the removal of my left breast, which is the breast that has the tumor in it. I've been doing more research as usual and talking to more people. I spoke to somebody recently who's a friend of mine who lives where I do in the Sierra foothills, and she had a mastectomy. She's also HER2 positive, and the trouble I've had, I think I've mentioned this before, but I can't find very many people, if any, who have HER2 positive breast cancer who have done exclusively alternative therapies. It's been really hard for me to find more than 1 or 2 people. And those people that I have found are not that far along. These aren't like 10, 20-year survivors that I found. So I've been weighing that, of course. 25% of the breast cancers are HER2 positive, so a quarter of the women with breast cancer have HER2 positive type breast cancer. So I'm really looking at that now, and I have an appointment on Monday with the oncologist here, and I have a few things I'm going to ask him. One is I want to let him know that I'm considering that, because right now the last thing we talked about was doing the full dose Herceptin and then the tumor getting small enough to do surgery on. Well, I've just been feeling something in my chest. It feels like it's on my heart. It's really hard to tell. I mean, how would I know, right? I mean, I can only feel like what's happening here. I can't see inside myself, but I kind of test this sort of painful sensation that I get that feels like it's on my heart by putting my hand under my breast and separating the flesh of my breast and the flesh and bone of the rest of my body. And when I put my hand there, I can feel that this pain I'm feeling is not in my breast. It feels like it's in my heart, really. It could be on a rib or something there. I'm really not sure. In my lungs. I can't tell, but I remember and recall that I felt this feeling all the way back at Halloween, which is just after I was diagnosed, and actually a little bit before that, because I remember telling my boyfriend that my heart hurt, and that was before I got a diagnosis. I would be like, oh, I feel this pain in my heart. What is that? So that feeling sometimes comes and goes. I was feeling it last night, and so getting back to what I'm also going to bring up to the oncologist, I found out about a bone scan, which I thought I had every scan that there was. I mean, an MRI and a PET CT and ultrasound like that, but I mean more like the hardcore scans. I didn't know there was such a thing as a bone scan. I thought maybe that was a PET CT, but there is. And last time on the video I made, I think it was the last one, I reported that I was having these headaches, and the oncologist felt on my scalp and said, you have nothing there. And a couple of people said, you know, don't rely on that, just somebody feeling your scalp. You need to get that checked out. So I haven't been having those feelings in my head. It just was kind of a 3-day thing that seemed to happen and go away. But I am feeling whatever that is in my heart. So I want to know about a bone scan. I want to let him know that I'm considering doing a mastectomy on the left side. And I also want to ask him about Perjeta. That's the other monoclonal antibody that's a counterpart to Herceptin. Supposedly that one has little to no side effects. Diarrhea, I mean, something like that. It's just really minor. Some people have reported with Herceptin having the joint aches and pains, and I didn't get any of that. I haven't experienced that myself. To me, that's a little bit of a more severe side effect than headaches, nausea, vomiting. To me, that's nothing. I'm okay to experience that, you know, as needed. So I want to ask him about Perjeta, the bone scan, possible mastectomy. I know I have a couple other things. I have a few other things, but we may not get to it, like exercise. I've really altered my exercise. I used to do, well, I still do it actually. I used to do a pretty intense hot Pilates, which, if you don't know what that is, it's a 95-degree room, and it's high intensive interval training, and it's pretty full on. I did my heart rate. I checked my heart rate when I was taking class before, and easily my heart is up at the 180 mark. And I don't even necessarily feel fatigued at that level. So the doctor I had in Carson City said that he would recommend that I didn't get my heart rate up that high, and that I limited that type of exercise to 3 times a week. Well, I was really doing it every day. So now I've just started to do a little bit more yoga and get back to something a bit more gentle, because it's been a really big adjustment for me. Actually, I'm competitive by nature. I'm competitive with myself. I'm competitive with those in my environment. I like to push myself, and I think maybe pushing myself is partly what got me here. But it's been something. It's really been something for me to scale back and do a little bit less. So that's what I'm doing. And I did want to ask him about that, but I don't think I will, because we generally run out of time. I mean, I could sit there and talk with him for 3 hours, you know, easily, but he seems to be able to give me 30 to 45 minutes or something like that. Besides the initial meeting we had was probably a good solid hour. The other thing is, I'm going to ask for another referral to UCSF or Davis. The woman that I spoke to, who was HER2 positive, who lives up here, a friend, she had surgery, I think at UCSF, and she referred me to that surgeon, or she mentioned their name, and also told me the oncologist she was working with as well. And I'm pretty sure the type of insurance I have will allow me to go there. So I just didn't feel great about the surgeon here. He's clearly intelligent and experienced, but I wasn't get the warm and fuzzies with the guy. You know, I mean, I asked him a couple of really point blank, straight questions, and he basically said, I'll do whatever the oncologist says. He wasn't really giving me his expertise from the field. You know, I didn't feel like I had a partner. I feel like I had a puppet who was just going to do whatever the oncologist said. So it didn't leave a good taste in my mouth. And he's the only surgeon I spoke to. So I definitely want to speak to 1 or 2 more. I watched this really great movie last night called Mama with Penelope Cruz, and she gets breast cancer in the film, and she has a mastectomy on one breast, and I found it at the thrift store for $1. It was just kind of ironic that I found it, and it's a really beautiful film. It's set in Spain and in Spanish, but it left something in me. It touched me. I was crying. Of course, it's really beautiful. She has a young son, and I have a young daughter, and there's a lot of dynamics going on there. But there have been a few things recently that have had me realize that surgery might be a better option. It might be the best option. The HER2 protein, when someone has overexpression like I do, it's considered very aggressive. So I can't just sit back and drink frozen lemonade and take my supplements and think that's going to be enough. At least I haven't seen anybody in the same situation who's doing that successfully for a long time. So I can't make that same choice without having good evidence for doing so. There was something else I was going to say. I'm reading a really good book right now that is about the mental state of somebody going through a cancer diagnosis, and it talks about being doom or gloom and desperate as one extreme, or being very nonchalant, like it's any other day and there's nothing really happening to me, a bump in the road. And then there's also the other type of person who looks at it as an adventure, and they say in this book, and I've seen it other places, that the person who sees it as an adventure has the best chance of success, who doesn't take it lightly and who isn't paranoid like they're going to die tomorrow. And that's my aim. It's really my aim. My aim is to really get the gravity and the seriousness of the situation, and also live the best life that I can, and live the fullest and most honest life that I can, and be living as richly as I can in every moment, which I don't feel like I'm doing. I feel like I fall short of that, but most of the time. But it's my intention, and it's my outlook. It's the way I see my situation, and I saw it that way before getting cancer. But recognizing having cancer, it's like it's just an invitation to be alive, yet stay inspired and positive action toward getting the best outcome I can get. So I've really just been putting one foot in front of the other as I go here. I don't have the answers. I haven't, just right from the beginning, I haven't known exactly what I was going to do. Some people go in and they're like, just remove both my breasts, give me chemo, do everything. And other people say like, wait a minute, I'm going to just do lifestyle changes and stuff like that. So I've just been figuring it out as I go, and I realized I had just hit the 3-month mark, and I've done a lot, and I am still doing a lot, but my course it's been changing as I navigate day by day with what the best choice is for me. So Monday should be pretty big for me. Speaking with him, I don't know exactly what will change, but I do, my mindset has changed a little bit. I didn't have surgery off the table, but it wasn't where I was going to start. So now it's looking like it's more of a likelihood, because I want to catch the cancerous tissue before it spreads, before it takes root or takes hold in any bones or any lungs, any part of my lungs. I obviously, once it goes there, it's a matter of just doing palliative care. It's considered incurable at that point, which of course there are many stories of people who have recovered from 4th stage and really dire diagnoses and situations, but I don't want to be fighting against the odds. So I'm hoping that the tumorous tissue is still only in my breast, and then if I remove my breast, that takes care of most of it. Then I still need to do everything I can to get my body and my immune system to fight off the invaders, naturally, like have a strong, robust immune system. So I'm still working on that, but I'm getting there slowly, day by day. Thanks again for being here with me and following along and watching. It really means a lot to me. I appreciate it.